Hello everyone, it's Dr. Gupta at Mōksha Derm, and today we're going to talk about acne. So acne affects patients of all ages, starting from even prepubertal ages all the way through menopause, and sometimes it's more prevalent in the younger ages, and sometimes it has an onset in adulthood. So what is acne? Acne is basically clogging of the pores, and in puberty it basically occurs because of an overproduction of sebum, because the hormones that are starting to generate in the body can force those sebaceous glands to make more oil, and those sebaceous glands are attached to the hair follicles, so as it's stimulating hair growth, it's also stimulating those oil glands to make more oil, and then you have a sort of a clogging of those pores and dead skin that sits in those areas, and you can get what are called whiteheads when it's just a closed comedone, or you can have the skin cells and oil mixing, and then it gets oxidized and it turns black, and then we call those open comedones or blackheads. And then you can also have sort of an overgrowth of bacteria. So the P. acnes bacteria likes to feed on all that sebum and dead skin, and that causes inflammation. So you can get fairly large even cysts or even mild acne. And the reason we want to control the acne, obviously, is because aesthetically it's not pleasing, and then it can lead to issues of self-confidence, and especially in the younger patients, it can actually even lead to depression or not wanting to show your face. And then, of course, it can also cause scarring. So we're trying to prevent long-term consequences of the acne as well. So when we start to see these early comedones forming, there are some things we can do to temper the oil production. We can use retinoids like Retin-A, we can use benzoyl peroxide, and there are a host of other topical medications that if they're well tolerated, can be really helpful. We also like to approach it from a health perspective. So if we can reduce the carbohydrate intake and reduce sugar intake, that can also be helpful to some degree, as well as trying to reduce stress, because stress can also cause an overproduction of oil. So, and then just eating healthy and staying hydrated, sleeping, making sure you're changing your pillow covers frequently. The masks nowadays are also causing sort of all that oil and dirt to just sit on the skin. But I do want to emphasize that acne is not a dirt issue. So washing your face 10 times a day isn't necessarily going to help. There are underlying medical problems with the acne, such as the overproduction of oil, that actually have to be taken care of. If that's not enough with the topicals, or if the topicals are too irritating, then we move on to oral medications like antibiotics, or even hormonal therapies such as birth control pills can sometimes help, and also a medication called spironolactone. We tend to use that quite often. That can help to block the testosterone receptor at the skin level and reduce the production of that oil. And those hormonal kind of therapies are especially more important and work better in our older patients. So those are some ways to control the acne. If it's extremely severe, then we can move on to Accutane, which is an oral form of vitamin A, and that has a very powerful effect on stopping that oil production. There are, of course, some side effects, so we monitor it carefully, but in the right patients and in the right settings, it can be just absolute lifesaver. We also have procedures in the office that can help. So there are various peels. We can do photodynamic therapy is extremely helpful, using blue light to reduce the P. acnes bacteria, using red light to reduce inflammation, using lasers to control the oil production. Especially our radiofrequency procedures can be extremely helpful. Sometimes thermage, which is a procedure we use for skin tightening, can actually reduce those sebaceous glands to the same level as Accutane might. And of course, every treatment is so individualized for that patient. Some patients can't tolerate topical therapies, others can't tolerate oral therapy. So we just have to figure out the right mix of procedures. Sometimes the acne also becomes resistant to one type of treatment. So it may be working for a while and then it stops working. Then we have to cycle through different options. So come see us if we can help you with your acne, and keep watching our videos for more information. Thank you so much.